So today we are going to begin with the ICD, and this is chapter 1, and in that I'll be covering three subsections, that is HIV, COVID and sepsis. Now let us understand what is HIV and AIDS. HIV is the human immunodeficiency virus, and it is the virus that weakens the immune system, making it harder for the body to fight the infection and the disease. And AIDS is acquired immunodeficiency syndrome. It is an advanced stage of HIV infection when the immune system is severely damaged and patients start showing some illnesses. And that's why you must understand what is HIV and what is AIDS, because if this concept is clear, then your coding will never be wrong. So this is a very interesting chart which talks about the various stages of the AIDS in the patient's body. So remember, whenever the virus enters the body, it will start killing the CD4 cells. And initially, when the cell count is very high, despite the virus in your body, in the patient's body, the patient will not have any symptom, and it is called as a asymptomatic stage. So the patient has a virus, and for that we use the term HIV positive, because the virus is there, and that's why we use the term HIV positive, but he does not have any symptom, and that is a asymptomatic stage. But as the CD4 cell count goes down, because they are getting killed by the virus, yeah, at one particular stage the cell count goes below 200, and the patient will have the AIDS defining condition. That is, any one disease related to the AIDS the patient will have, and that time, rather than calling him HIV positive, we call him AIDS patient. So this is a very important terminology, or the the understanding of this disease one must. So these are the few illnesses which I have given here. That a patient who has a HIV infection, he may have fever, weight loss, pharyngitis, esophagus with sores, myalgia. Then there could be the enlargement of the spleen, which is called as the splenomegaly, lymphadenopathy, that is the diseases of the lymph. Then there could be the encephalitis, meningitis, that is the inflammation, retinitis, pneumocystitis, tuberculosis, tumor that develops in much later stage, esophagitis, and chronic diarrhea. So you will see that slowly this HIV virus starts making your system very, very poor, and then because of that you develop all this illness. Now, what are the ICD code that we use for AIDS? There is a B20 when the patient is got AIDS. When the patient has got AIDS, then we use the code B20. R75 is an inconclusive lab evidence of the HIV. Z20.6 is the contact with a suspected exposure to the HIV. Z11.4, it is an encounter for the screening for HIV. Z71.7 is HIV counseling, though it is a negative result or the positive result. Whatever may be the result, the counseling is done for the patient. Z21 is asymptomatic HIV, positive test result with no symptom, and O98.7 is the HIV disease complicating the pregnancy, childbirth, and puerperia. So these are the important code which we are going to see in this lecture. So there are important guidelines regarding the selection and sequencing of the HIV codes, and we are going to see them in details one by one. Now let us understand some more terminology. One is inconclusive lab evidence for HIV. In this case, you may need more tests to confirm a diagnosis. Inconclusive is nothing but uncertain. This means you aren't sure. Your test wasn't clearly positive or a negative. And there are many reasons why this may happen. And that's why when the test results are inconclusive, we write the code R75. So contact with and a suspected exposure to HIV. So whenever the patient had contact with the HIV patient or there was a suspected exposure, then we write Z20.6. Encounter for screening of HIV, Z11.4. So remember, you need to read why the patient has come. Has he come for the screening, or has he come because he had a contact with a HIV patient and he wants to know whether he has got the infection? And depending upon that patient case, we will do the coding for that patient. So I previously I explained about the asymptomatic. Asymptomatic, when we will use it when there are no symptoms. So the virus has entered the body of the patient, but the patient is not showing any symptom. That is very important. Any symptom, the patient is absolutely healthy, normal like any other patient, and that is the time we will use Z21. Now, when the patient is admitted for the HIV related condition, okay, HIV related, any condition which is related to the HIV, or if he has developed a HIV disease, then he is no more a HIV or asymptomatic, then he becomes a AIDS patient. And because he has developed some condition, and then we write B20. And remember, once we start writing B20 for the patient, we can't go back to Z21. Okay, because this is very important. There is a one important sarcoma. It is a Kaposi sarcoma. It is an indolent multifocal non-metastasizing mucosal and cutaneous tumor, probably of the endothelial origin, and which is the characteristic feature of the patient who has AIDS. Now remember, B20 means the patient is a AIDS patient. Many a time there are alternative wordings are used. So in order to test you during the CPC exam, and those are the HIV infection symptomatic, HIV disease, HIV CD4 count below 200, HIV opportunistic infection, and AIDS related complex, or HIV related opportunistic disease treated during the prior encounter, now does not have any infection. But in all this scenario, we are going to write the code B20. Okay, so pay attention to all these alternative wordings, because during the exam, they invariably test you by giving these alternative wordings. So code only confirm cases of HIV. This is an exception to the hospital inpatient guideline. And in this context, the confirmation does not require a documentation of the positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has HIV related illness is sufficient. Patient admitted with anemia with a possible HIV infection. If this is the scenario, then we will code only for the anemia, because the provider has used the term possible HIV infection. If the provider uses the term possible, suspected, could be, it is a probable diagnosis because it's not a confirmed diagnosis. And according to the guideline, we will code only the confirmed cases. So it is D64.9. Now the second guideline is selection and sequencing of the HIV code. Patient admitted for HIV related condition. If the patient is admitted for an HIV related condition, the principal diagnosis should be B20, human immunodeficiency virus disease, followed by additional diagnosis code for all reported HIV related condition. Now let us take this example. HIV patient has come today with pneumonia due to pneumocystitis carni. So how will I code this visit? So I will write B20 code first, followed by the B59. Now, why? Because the pneumonia due to pneumocystitis carni, it is an HIV related condition. So the HIV diagnosis code is reported first, followed by the code for the pneumonia. And in this case, what is the code I have written? B20, because now he has developed one disease related to the HIV. That means he is now B20. Now we cannot write Z21 for this patient. Now the third important guideline is, what if the patient with HIV disease admitted for an unrelated condition? If the patient with HIV disease is admitted for an unrelated condition, like for example traumatic injury, the code for the unrelated condition should be the principal diagnosis, and other diagnosis would be B20, followed by additional diagnosis code for all reported HIV related conditions. So this is a situation where the patient is already a AIDS patient, or he could be a asymptomatic patient, but today he came to the doctor not for his HIV problem, but maybe he had a fracture of his hand, and the fracture is no way related to the HIV. So whenever you are writing that code first, you are trying to tell the insurance company that today he came for the fracture, but he still has a HIV, or he has AIDS, and because if he has AIDS, that means he has some related condition. If he has a asymptomatic HIV, you will just write Z20. But if he has some disease developed because of the HIV, then you will write B20, and then whatever the additional diagnosis for the HIV related condition. So patient with unstable angina of the native coronary artery atherosclerosis comes to doctor, and he is a AIDS patient. So how am I going to code this? I will code I25.110. That will be my first code, because why did the patient come today? For the atherosclerosis problem, and that is no way related to the AIDS. But he is a AIDS patient. That also I'll have to mention on this patient case paper. So I will write that as my second code. Whether the patient is newly diagnosed. Whether the patient is newly diagnosed or has had a previous admission encounter for the HIV condition, it is irrelevant to the sequencing decision. So newly diagnosed multiple cutaneous kyphosis sarcoma lesion in a patient with a HIV disease. So in this case, this was a HIV patient who had a HIV disease. That means he has already a AIDS patient, and today he came for the kyphosis sarcoma. Because, so one more new condition has developed in this patient. So in this case, what you will write is, you will write B20 first, followed by the kyphosis sarcoma. Even though the HIV was diagnosed on the previous encounter, it is still sequenced first when coded with the HIV related condition. This is very important because the condition is HIV related. So you are going to code the B20 first, followed by the kyphosis sarcoma. Asymptomatic human immunodeficiency virus infection status is to be applied when the patient without any documentation of symptom is listed as being HIV positive, non-HIV, HIV test positive, HIV infection, or similar terminology. That time only we can code Z21. But we do not code if the term AIDS or HIV disease is used, or if the patient is treated for any HIV related illness, or is described as having any condition resulting from his or her HIV positive status. Then in that case, we can use B20 only. Patient admitted with acute appendicitis, status positive HIV test with no prior symptom. In this case, my first code will be the unspecified acute appendicitis, and second code will be Z21. Z21 is sequenced second since the documentation indicate that the patient has had a positive HIV test but has been asymptomatic, and the appendicitis is not AIDS related complication and is sequenced first. And you can use the previous guideline also. If the patient comes to the doctor with a condition not related with the HIV, so then in that case you will write the unrelated condition first, and followed by the second diagnosis could be the asymptomatic HIV or the AIDS, and in this case it is asymptomatic, so I am writing Z21 as the second code. So you can utilize that guideline as well. So previously diagnosed HIV related illness, patient with any known prior diagnosis of HIV related illness should be coded to B20. Once the patient has developed an HIV related illness, the patient should always be assigned the code B20 on every subsequent admission or encounter. Patient previously diagnosed with any HIV illness should never be assigned R75 or Z21. So if the HIV disease has developed to the patient, we give him the permanent diagnosis of B20, and then we cannot go back to Z21, and neither we can give R75. We will always maintain B20 for that patient henceforth. Next important guideline is HIV infection in pregnancy, childbirth and the puerperium. During the pregnancy, childbirth or the puerperium, the patient admitted because of an HIV related illness should receive the principal diagnosis code of O98.7, that is HIV disease complicating the pregnancy, childbirth and the puerperium. Codes from the chapter 15 always take the sequencing priority, and O98.7 is the code from chapter 15, and then we can write B20 for this patient. So suppose if this is a pregnant patient and she has developed a HIV related illness, that means she is a AIDS patient. So I will write the first code O98.7, and there are some more digits. And then the second diagnosis will be B20 because she has developed HIV related illness. Suppose if the pregnant woman with a HIV positive status, that means she has a HIV but otherwise she is absolutely healthy. In that case, my first code will be O98.7 and few more digits, and then the Z21 because she is asymptomatic. So let us take one example. A pregnant patient in her second trimester at 17 weeks presenting for a checkup. She is HIV positive. So my first code is going to be from the chapter 15. And how do I know? All the chapter 15 code starts with the alphabet O. So here O98.712 human immunodeficiency virus. This is complicating the pregnancy, and the last digit 2 stands for the second trimester. Then the second is Z21, that is a asymptomatic human immunodeficiency virus. Why am I taking that? Because they have written only the patient is HIV positive. They haven't mentioned whether she has developed HIV related condition or the disease. And then the third code, I am going to write a week of gestation. This is I haven't taught you right now, so you should understand that this is a third code that I will write. So this is these three codes I will write for this patient, and that will explain everything, that she is a pregnant patient in her second trimester. She has HIV and but she is asymptomatic and she is in her 17 weeks of gestation. So encounter for HIV testing. That means the patient has come just for testing of the HIV. So exposure to HIV and the patient is testing Z20.6. Asymptomatic screening. Okay. Z11.4. Screening is basically every year you are just finding out whether you have AIDS or no. And then the counseling on HIV and STD Z71.7, and additional diagnosis for the high risk sexual behavior if any Z72.5. So you need to read why the patient has come, and depending upon that we can write these codes. So let us understand these guidelines by answering certain questions. The patient has a history of symptomatic HIV and has been treated for an HIV related illness. Which ICD-CM code is reported? Now you will see all this code. Z21 is asymptomatic, B20 is AIDS, Z20.6 is one more code, and R75 is inconclusive. Now here the patient has a history of symptomatic HIV. That means there is a symptom which has developed. That means he is a AIDS patient. So the correct answer will be answer B. Now the next question is 50-year-old male HIV positive has a fever and sputum culture and a chest x-ray result in the diagnosis of the pneumocystitis pneumonia, documented as pneumocystitis pneumonia due to AIDS. What are the required ICD codes? So now we are going to see each and every option. The first option is B20, B95. Second is B95, B20, Z21, B95 and B95, Z21. So now remember, the patient has already developed pneumocystitis pneumonia and due to AIDS. So he is no more asymptomatic. So that will eliminate my option C and option D. And in between A and B, what will be my first answer? It will be B20 and then the B95, because if the patient has developed HIV related illness, then you will write the B20 as a first diagnosis and followed by the related condition. So what will be my correct answer? A. What is the correct word for an HIV patient who has never been treated for the HIV related condition? So in other words, he is a HIV patient but there are no symptoms. So he is a asymptomatic patient, and so your correct answer is Z21. So newly diagnosed multiple cutaneous kyphosis sarcoma lesion in previously diagnosed HIV disease. And so let us eliminate the wrong option, and in this case the option Z21 is wrong because he is a HIV disease, that means he is already AIDS patient, and in that case asymptomatic code is not correct. So I'm going to eliminate A and C. And newly diagnosed condition in previously diagnosed AIDS patient, we always code the AIDS code first, that is B20, followed by the newly diagnosed condition. So answer B is the correct. So when the patient has a blood test for the HIV that is inconclusive, what ICD-10CM code is assigned? So because the lab test is inconclusive, the right code is R75. So here we finish the ICD-10CM chapter 1. In that we have just finished the subsection of HIV. There are few more subsections which are very important in chapter 1, and then we will have one separate session on all the exam questions related to this topic, but that we will conduct it later. There are some practice questions I have given. Kindly do the practice. It will help you to strengthen your guidance. So roughly 15 to 16 questions are given, and that will help you to do more practice. So try and answer few of these questions which will strengthen your guideline, and we have finished the HIV topic, and now we will go on with the COVID. That's a new topic that has been introduced in 2022.